take a complete and accurate medical history. I can say that without any hesitation at all. But here's the other part, Heather Dawn. Actually read it. Take the medical history and then take the few minutes it takes to read it so that you can really understand the patient. I always say this, never treat a stranger. Never treat a stranger in your chair. Know that person, know them well, know the medications, know the supplements, know everything about them so that when you make those what you could be considered life-altering decisions on their part, you're making them on solid, firm ground therapeutically.
Welcome to another episode of The Irreplaceable Dental Assistant. And you know I have a treat for you today. I always have a treat, but this is an extra special treat. My guest today is Tom Viola. Welcome, Tom. How are you doing?
I'm fine, Heather Dawn. Thank you so much for the invitation to be a part of this. I was looking forward to it for a long time now, and I'm glad we're finally able to make it happen. This is amazing.
I am telling you. But, good things come to those who wait. I've been patient.
You certainly have been very patient with my travel schedule. I appreciate it. I do.
So I know that I'm in for a good thing.
Well, thank you so much.
Well, I know who you are and your fabulousness, but can you share a little bit about yourself so our guests can understand who you are and why we would invite you to this platform today?
Well, thank you so much. So my name is Tom Viola. I have been a pharmacist for over 30 years now, and I love dentistry. I got involved in dentistry as a dental pharmacologist about 20 years ago now. Started teaching dental hygiene students and dental students pharmacology, and started lecturing and speaking on pharmacology to dentists and dental hygienists. And it's been a real treat. I really enjoyed the entire experience. It's something that I have a passion for. And you know what they say, if you love what you do, you never work a day in your life. So I really enjoy what I do. And I'm very happy to have been a part of it. I'm very blessed is how I would sum it up.
Well, I happen to know for sure that you love what you do, because I have been privileged to be in the audience when you're sharing, and boy, do you turn it up.
Well, thank you so much.
It's what you call a combination of entertainment and education. What's that? Edutainment?
I think that's what they call it. Well, pharmacology is boring. I got to do something to make it active, make it exciting. So.
You found the secret sauce. That formula is just fantastic, because I had the privilege of chairing an international meeting, and we had you as a speaker first thing in the morning. Pharmacology. Oh my gosh, if that combination doesn't put people to sleep. And everybody was like, wow, they were tuned in, they were engaged. And this was on Zoom, so you can imagine.
It was a great audience. They were so engaged and so attentive. I was very blessed to have them that first class in the morning. That was great.
Yeah, well, thank you. So I have a question for you, Tom. Sure. How do you define the word drug? What is a drug? I mean, we hear the word all the time, but how do you define it? Is it alcohol? Is it something illegal? Is it the aspirins that you pop? What is a drug?
This question comes up a lot, Heather Dawn. I mean, what qualifies as a drug? Because patients take a lot of different things. They take medicinals, they take prescription drugs, but they also take over-the-counter drugs, they take dietary supplements, they take substances. So what is that line between what's a drug and what's not a drug? And so from a very pharmacologic standpoint, you can make the detailed explanation and say a drug is something that's technically not required for life. Okay, so vitamins and minerals and supplements are all required. Drugs are not required for life. But if you have a serious condition where you need the drug to treat that condition, then obviously that drug becomes a requirement for life. But then from a different standpoint, you could say, well, no, a drug is something that I would use to diagnose, prevent, or treat a disease. Well, you could make that argument for a supplement as well. You could say that supplements do the same thing. So it gets a little blurry. And that's why I think the FDA here in the United States has it right when they say, if it's used to diagnose, prevent, or treat a disease, it's a drug. Anything else is a supplement or a vitamin. And to respond to the second part of your question, what about aspirin? What about alcohol? Well, in the strict definition that I just gave, aspirin would be considered a drug, but alcohol would not be considered a drug because technically it's not used to treat a specific disease. And that's what I use as my sort of compass as to trying to decide where that blurry line is.
Well, that's a good starting point. I don't think I've ever heard that definition before, but I certainly understand it. So when we talk about all these supplements that people are taking, these herbs and natural remedies that people tend to be moving towards, if they're not considered drugs, they are considered supplements?
Right. So if you lump all of the dietary supplements, the herbal supplements, and other natural remedies together and say they're all dietary supplements, are they considered drugs? It actually depends on the country. Some countries in Europe specify that they're not technically drugs, but they're not supplements either. They're natural remedies. Natural remedies as far as they define it. Here in the US, the FDA would say those are dietary supplements, whether they're herbal or not. They're not considered drugs, but this gets a little sticky because the FDA here in the US does not have the authority to oversee dietary supplements, only drugs. So you could bring a dietary supplement to market in the US without the FDA's approval and without the FDA's oversight. Now, that means that the burden of compliance is on the manufacturer of that dietary supplement. Sometimes that gets a little loose, and people suffer adverse effects. For example, you could buy a bottle of red rice yeast, which is a dietary supplement used to lower cholesterol. And
Yes.
Technically, although I doubt this happens all the time, but technically, none of the capsules in that bottle have to have any red rice yeast at all. And some of them can have other things besides red rice yeast in them because the FDA is not guaranteeing any standardization or purity of the drug itself.
And I think the concern that I have is that people assume that if something is natural, it's always going to be good for you. You can take it in abundance, but nothing operates in isolation because some of these things can still affect us negatively. They can still interfere with drugs or prescription medication that we may have. So it gets a little hairy.
Well, Mother Nature would never harm us, correct? And therefore, we can take anything we want that's natural and take it in any dose we want, because that was the prevailing attitude for a long time with supplements, that supplements are sort of an add-on to our lives. And as a matter of fact, some recent studies have said that patients, about 20% of the time, combine prescription drugs with dietary supplements that do the same thing to get more bang for their buck, if you will. So, you're on, let's say, Zoloft or Lexapro as an antidepressant drug, but you're also taking St. John's wort at the same time, which has the same effect. But that's where it gets blurry, as you said, Heather Dawn, because now those two things may interact. First of all, it's an additive mechanism of action, so they both do the same thing, which increases the effect. And I guess that's what the patient's looking for, but that can have a detrimental effect as well as too much effect. And also additive as far as side effects. So if Lexapro causes bleeding and St. John's wort causes bleeding, then taking them together increases your risk of bleeding, let's say during dental procedures, and even something as minor as cutting yourself while you're shaving.
Yes. So I don't know. Sometimes it feels like we're playing Russian roulette because even when you're going through your treatment history and you're asking the patients if they're taking any medication, they make the distinction between what's natural and what's prescribed.
So true.
Unless you drill down and ask specifics, you may never know that in addition to that, they're taking this supplement to boost the effects.
Right. And that's why I tell everyone in my audiences and all my students that when you're going to take a medical history, you never use the word drug or medication. You use very open-ended questions. My favorite 3 questions that I've been saying for a while now. First question is, what do you take? Don't qualify it. Don't say medication. Don't say drug. Just say, what do you take? Then follow it up with, why do you take it? Because a lot of medications and dietary supplements are used for things other than what we might know at the time. And then the third question is, did you take it today? Because I want to know if it's going to have an impact on therapy and an impact on my vital signs.
Yeah. So good thing about this reviewing of the medical history, is it okay for a dental assistant to review the medical history and update the dentist? Or would that be a breach of the patient's privacy?
I don't believe that's a breach of the patient's privacy. I guess it would depend on the state maybe or the country you're residing in. But I would say that here in the United States, from my experience, dental assistants are a vital part of the dental team. As a matter of fact, I've always said, and I've been talking for dental assistants for some time now, that to me, the dental assistant is the front door of the office. They're the first person that the patient interacts with. They're the person that leads the patient from place to place throughout the office. And they're the ones that establish, I think, the greatest relationship with the patient in that short period of time. And the level of confidence, the level of trust is all in the dental assistant. So why not be the person as a dental assistant then to take the medical history and really get some answers so that you give the rest of the team a head start, right? So now the dental hygienist needs that information. You've got part of the information written down already. The dentist needs that information. You've got part of the information written down already. And the more informed and the more educated dental assistants become about pharmacology, the more they can fill in that medical history with good information and facts, because let's face it, patients don't want to tell you what's wrong with them necessarily.
That's so true.
Right? They don't want you to know. They don't think you need to know. But if you just know their medications and you have a working knowledge of pharmacology, you can fill in the blanks yourself.
Absolutely. Absolutely. I would underscore that as well, because sometimes I don't know, I guess the culture is different in different offices, but the more people on that team who understand the value of what they bring to the team, the better the team, right? And
no question. Yep, absolutely.
I believe, like you, that the dental assistant is probably one of the most important persons in that office, the connector between the patient and the providers.
They are the liaison. They are the person that makes that patient feel comfortable in that office and sitting by the chair, no matter who's working on them, the hygienist or the dentist, they're the consistent person in that office. That's their liaison, that's their advocate. And let's put it a different way as well. You know, the dental assistant is underutilized many times here, in my experience in the U.S. They're busy, but they're busy doing busy work when they could be doing so much more productive work that we sometimes fail to include them. But it is a team. And working in a dental office is like working on an island, a deserted island. The knowledge, the collective knowledge of pharmacology in that office is based really on the person who's the most knowledgeable about pharmacology. So why not let it be the dental assistant who leads the dentist and says, hey, look, I learned in this course that if a patient takes this medication, they might have I learned that too. And now there's a sense of camaraderie between the dentist and the assistant and even the hygienist. And that's what it means. It means working as a team for the benefit of all of the patients there.
I love that. So Tom, what are the top 5 drugs or supplements that most often affect dental treatment, and how do they do that? I can
probably break that down into 5 groups, okay? And give you a couple examples of each. So I think the first group I would talk about would be drugs that affect immunity. Okay, because remember, and I love this expression, people sometimes give me a look when I say it, but in dentistry, we work in a cesspool. Right, we work in a fluid medium full of bugs, if you want to look at it that way, and we inflict damage on the tissues in that fluid. So immunity is important because the same bugs that are there naturally can, if given a foothold, cause infection. So any drug that affects your immunity, like a steroid or even cannabis, even marijuana, can cause dental infection after the fact, after the procedure, and also make the patient more prone to dental infection during and between appointments. Drugs that elevate blood pressure and pulse are probably my next category. And it would be things like stimulants, like ADHD medications, some antidepressants, and yeah, let's go for it and say it's even cannabis again. Raises your blood pressure, raises your pulse, And so that's going to affect the vital signs. It's going to affect my decision as to whether or not to treat you. And it's going to affect, how fragile or friable your blood vessels are over time. On the same topic, then I would say drugs that affect bleeding. So anticoagulants, antiplatelet agents, dietary supplements like St. John's wort, and some others like the 4Gs. I call them 4Gs because they all start with a G. Garlic, ginkgo, ginger, and ginseng all cause bleeding during procedures. So you can be on an anticoagulant or an antiplatelet drug like Coumadin or Plavix and bleed during a procedure, or you could be just on ginger or ginkgo and bleed during a procedure. And heavens, if you take them together, that's even more bleeding. Right?
Yes.
I guess the other category would be drugs that affect local anesthetics. Right? We use local anesthetics all the time. So everything from stimulants like methamphetamine and cocaine, because they're so structurally similar to our local anesthetics, if you had a previous history of using methamphetamine, you may be more resistant to the effects of local anesthetics. Same thing with cannabis, right? Cannabis makes you more resistant to local anesthetics, and the same thing with a drug as mundane as Tagamet, which is sold in the U.S. as a drug that shuts down acid production. But Tagamet, in the same family as Pepcid and Zantac, is known to be interacting with lidocaine and making lidocaine cause more issues with toxicity, both in the central nervous system and the cardiovascular system. Again, if I took Tagamet because I have quote unquote heartburn, I may not tell my dental assistant, dental hygienist, or dentist that I'm taking that drug because it's for heartburn. You don't need to know that. But in the meantime, it does have a significant effect on dentistry. And I guess the last group would be drugs that cause central nervous system depression. Benzodiazepines. A lot of people take Xanax and Ativan for anxiety. Patients use opioids, right, for other conditions, chronic back pain. Those all cause central nervous system depression, but yet we use those drugs in dentistry as well. So if you're taking, let's say, a central nervous system depressant like Xanax for anxiety, and then you're coming into a dental office and getting conscious sedation done, and I'm giving you Halcion during that procedure, that having taken both at the same time increases the risk of side effects like central nervous system and respiratory depression.
Yeah.
I know, right? That's all. Welcome to my world.
I know. You make my world scary.
It's a scary place to be. That's why I'm here, to guide you, Heather. And so you can help me as well.
The truth is that the more you know, the more armed you can go into a situation and be in control. So yes. I'm really grateful for those top 5. So is there one thing that you wished all dental offices would do on a routine basis to protect the health of our patients?
Take a complete and accurate medical history. I can say that without any hesitation at all. But here's the other part, Heather Dawn. Actually read it. Take the medical history and then take the few minutes it takes to read it, so that you can really understand the patient. I always say this: never treat a stranger. Never treat a stranger in your chair. Know that person, know them well, know the medications, know the supplements, know everything about them, so that when you make those what you could be considered life-altering decisions on their part, you're making them on solid, firm ground therapeutically.
You know something? I always ask my guests if they have a quote to leave us with, but you left us with a humdinger a while ago. I don't know if you have an additional one, but I love never treat a stranger because it simply means that you have to invest the time in making sure that you understand what's going on with this person in front of you.
Yeah, I got one more for you, Heather Dawn. Ready?
Good, let's go.
Be the bartender.
Be the bartender.
Be the bartender, which means listen when your patient speaks, right?
Yes.
And speak when you need to speak. And I'll just give you one example. There's a lot of medications that patients take on a regular basis that can cause suicidal thoughts. Now, if I'm having those thoughts, I may not tell my clergy person, my parents, or my family, even my significant other. But I still want to tell somebody. And who better than someone who listens to me, who's approachable, who's easy to talk to. who's got the time to spend with me. That's everybody in the dental world. So if I'm that person and I have suicidal thoughts, I might say them to you, but are you listening? And if you are listening, this is your chance to speak and say, don't be the turtle and hide in your shell. This is the time to speak up and say, listen, that could be a side effect of the medication you're taking. You should see a doctor. Or, hey, everybody goes through times like that in their lives. And I completely understand, here's a phone number you can call and talk to somebody about it. So if it's the suicide prevention hotline, give them that. If they're transgender, give them the Trevor Project phone number. Give them the resources they need so that they don't feel alone, number one. And number two, you made a difference in their life. You saved their life. If only you were listening and only able to speak. And that's why those are skills that are hard to acquire. And that's why I'm glad I was a bartender in my life, so I was able to learn those skills. So I tell everybody now, be a bartender, listen and speak. Be that person for your patient.
Love it, love it, love it. Now my guests have a tiny window into how you can present important information in such a way that you just pull us in. Now, I know that we've basically come to the end of this podcast, but suppose people are intrigued and they want to hear more from you. Where can they find you?
Best place to find me is my website. It's tomviola.com, because I don't have a creative bone in my body and I had to name it after myself. So that's an easy name to remember for a website. And I'm on social media everywhere at Pharmacology Declassified. So you can find me anywhere.
Pharmacology Declassified. Tom, it has been my pleasure. It was well worth the wait, my friend.
All mine. Pleasure's all mine.
To Texas, to Jamaica, to wherever. Finally pinned you down. And
You
it
did.
was worth the track.
Same here, Heather Dahl. What a great service you do to all of the people here in the world of dentistry. I'm so glad that you're out there doing what you do. Thank you so much.
Thank you so much. You have to make me one promise.
Anything.
That you'll come back at a later date and share some more of your pearls with us.
You call, I'll be there. No worries at all. You can call
All
it.
right. Maybe we'll be side by side next time, on the beach. You with a margarita, me with a grape juice.
I felt cheated with COVID and being able to do it by webinar. I wanted to come to Jamaica. So yes, I'll be there. Definitely.
We have to give you a do-over.
Yes, please. Yes, please.
Well, thank you very, very much.
Thank you so much. Take care.
Oh my goodness, I am unapologetically a Tom Viola fan. He brings it every time. And let me tell you something. If you listen to this episode a couple of times, the knowledge that is in this one podcast can take you to the next level at work. I'm telling you. Listen, remember, when taking a medical history, ask the patient, what do you take? Don't be specific. Why do you take it? And did you take it today? And make sure that we always take a complete medical history. And here's the catch. And read it. Never treat a stranger. And Tom advises us to be the bartender, listen keenly, and speak up when needed. Remember, if you want to find more from Tom Viola, look for Pharmacology Declassified. He certainly did declassify a couple of things for us today. Remember, share this. Don't keep it to yourself. Like, subscribe, keep it going, because life is better when we live, learn, and grow together. Blessings.